Is everyone enjoying lunch? Great, great. So let's get started with our exciting program. The Fulton-DeKalb Hospital Authority is owner of the Grady Health System. We are pleased to have the CEO of Grady, John Hoppert, who has positioned Grady not only to be one of the top indigent healthcare systems in the country, but also the premier academic hospital in the country. Mr. Hoppert will be followed by Dr. Christine Green, the Distinguished Chief of Staff of the Georgia Department of Public Health, who has spent her career committed to the elevation of community health. Please welcome them at this time.
Good afternoon. On behalf of the 6,000 employees, 1,500 physicians, and nearly 600,000 individual patients that we touch every year, I bring you our best from Grady Health System. A moment of personal privilege here. 1982 was a big year for me, both good and bad. It was good because as a musical theater junkie, probably out of the womb as a musical theater junkie, I got to go to New York and see Sheryl Lee Ralph in Dreamgirls, and have been a fan ever since. Actually, I went back several times to see Dreamgirls as a musical theater junkie. But also in 1982, I was in college, and friends of mine began to mysteriously pass away. My roommate from college became very sick and within 2 months passed away. My best friend from my small hometown in Fort Smith, Arkansas, became ill living in New York, working in New York, and passed away. At that point, white gay men from my university were going off for Christmas holiday and not coming back. And you would hear about multi-system organ failure, and within months they were gone. I have spent a lot of years going to funerals for friends and others who have died from HIV and AIDS, or from AIDS. Now we find ourselves in a new epidemic right here in Atlanta, Georgia. Grady has the incredible privilege of operating one of the leading AIDS treatment and research centers in the country. Atlanta is blessed to have the CDC and the Center for AIDS Research located right here in our hometown. But at the same time, as you heard earlier, we are also one of the homes of the largest number of new HIV cases in the country, something we have to address. The Infectious Disease Center over on Ponce is actively managing and working with 6,500 full-blown AIDS patients. That number has been increasing. As a result, we at Grady Health System, along with Fulton-DeKalb counties, the FDHA, and a number of private donors are making a commitment to invest $25 million into that infectious disease center so that we can expand the services at the IDP, and also increase our research efforts along with Emory, Morehouse, and thanks to the help of Gilead as well. We want to be here and we want to respond to this epidemic. But on the other end of this epidemic, there are hundreds of heroes sitting right here in this room who are fighting the fight on the front line to make sure that we reduce the number of new cases of HIV. By the time the patient gets to us, it's really an advanced case of HIV and AIDS. I hope the work of the FDHA and what the FDHA has committed itself to today, which Tommy, Lisa, thank you so much for bringing attention to this issue. But it will help ignite our community to do the work that we need to do to address the social issues, to address the access issues, to address those conversations that need to be happening from pulpits and institutions around our community, that we can influence those discussions and really bring this epidemic to an end, much like we did in the 1980s and 1990s. So I do have to say once again, I got to see Dreamgirls when I was 22 years old. And I got to see Sheryl Lee Ralph and company, and that's still a highlight for me. So I was ecstatic when I saw she was going to be here today. Thank you to each and every single one of you and the work you're doing, either through access, mental health, medical care, and every aspect of the human condition. We are in a time where the work that we do to serve those in the most need is somewhat under attack. And we are fighting the good fight to make sure that we maintain the funding that is needed to make sure that the patients we serve get the services they need. Thank you very much.
Good afternoon, everyone. The person who introduced me as Dr. Christine Green. So the first thing I want to do, because I do know so many of you in the room, and you were all impressed that I had made it to that level, that I wish that I had gotten that far, but I'm not a doctor. I'm the Deputy Chief of Staff for the Department of Public Health. And I bring you greetings today on behalf of Commissioner Pat O'Neill. Dr. O'Neill is our new commissioner. He's recently replaced Commissioner Brenda Fitzgerald, who has gone on to be the Center of the CDC, the Center of Disease Centers. I'm saying it wrong. Anyway, the director of the CDC. I was going to spell it out. But today the commissioner is giving the State of Public Health address to a convening of all the public health officials in the state of Georgia in Athens. So he sends his regrets that he couldn't be here today and gave me clear direction on what I should be saying to you. Okay, so because the focus of this summit is HIV facts, faith, and myths, let the truth be told, Commissioner O'Neill has asked me to bring you the facts about what we in public health believe is the most important thing that you all should know as it relates to HIV in Atlanta at this time. The fact is, the statistics are alarming for young, Black, gay males. If current rates persist, half of our Black, gay, and bisexual men will receive an HIV diagnosis in their lifetime. This is not acceptable. The cornerstone of public health is prevention. Pre-exposure prophylaxis, or PrEP, which you spoke a little bit about earlier, and I was excited that you gave that prelude, is an HIV prevention strategy for individuals who are not a part of the statistics yet. PrEP has been shown to provide 92% to 99% reduction in HIV risk for HIV-negative individuals who take the pills every day as directed. Now, every day. Big ask, right? That's an important part of that message. More than half of the HIV/AIDS cases in Georgia are in the metropolitan Atlanta area. So it is imperative that the leaders and people of Atlanta join in spreading the word about PrEP and doing our best to prevent further spread of this disease. This is critical for the gay and bisexual men, but it is also critical for our women and our children. Georgia is above the national average for perinatal transmission of HIV, another unacceptable circumstance for this state. In females diagnosed with HIV, heterosexual contact accounts for more than half of the transmission. So it is critically important that when we continue to educate gay and bisexual men on the importance of continued condom use as well. These are big asks. But the message is clear and a difference can be made. We can prevent further spread. The Department of Public Health is very appreciative of the Grady Health System and the role it plays in public health and HIV/AIDS. We've worked together closely since the beginning of HIV to treat those infected individuals in need of assistance. And I can personally attest to this as I worked in the Fulton County Health Department, 99 Butler Street, used to be Butler, it's Jesse Hill Jr. Drive now. Way back when those very first HIV cases, AIDS cases, presented themselves, we opened the first Ryan White Clinic in the state of Georgia. And Grady was our steadfast partner. When cases got too difficult for the health department, they transferred to Grady. It's sad that that still has to occur, isn't it? But we have an opportunity now. Y'all, we have an opportunity to make a difference. Grady's working with us now on another one of the Department of Public Health's highest priorities, which is early brain development. During the first 3 years of life, the brain undergoes its most dramatic development, forming more neural connections in those years than at any other time period in their lives. 3 years, a baby till they're 3 years old. When this early development is not nurtured, the brain's architecture is adversely affected, and young children fall behind in their development and learning. Early exposure to language sets the foundation for cognitive ability, literacy, school readiness, and ultimately educational achievement. In Georgia, only 34% of students meet grade level proficiency at the 3rd grade. That's another, unacceptable for us. 3rd graders who cannot read at grade level are 4 times more likely to drop out of school before high school graduation. And we all know the difference literacy and a high school diploma make in your ultimate life outcome. The same is true for health literacy and health outcomes for chronic diseases, including HIV/AIDS. Public health needs community leaders such as you to spread this message as well, to start making a difference with our babies when they're born. This is not anything that's difficult. It's simply spreading the word that those little babies need their moms, dads, grandmothers, their support structure around them to talk to them. I always do this like I'm holding a baby when I try to describe it, but look at the baby, engage the baby, and talk to the baby. And every word that baby hears, the brain is building. The baby needs to hear the words in their native language as well as English, but the native language is the most important thing. We need these babies, we need our future generation to grow up strong enough of mind, make it through 3rd grade, graduate from high school, know what it means when we start talking about risks and words like prophylaxis and things like that. You have to build the next generation to be stronger in order to really, in the long run, fight the things in society that are against our children, that set them up for where they end up. Other high priorities for the department at this time include addressing the opioid epidemic and working on the establishment of a cardiac care system designation. We're hard at work at the state's public health concerns, and we invite you to join us by looking at our strategic plan to learn more, by contacting us to join you in your efforts to spread the word on HIV, early brain development, and really all of our priorities. And we thank you all so much for what you all do every day to support public health in the state of Georgia.
Thank you so much, Deputy Green and Mr. Hubbard. Now, for our keynote speaker this afternoon, we have Ms. Sheryl Lee Ralph. Original Dream Girl, Sheryl Lee Ralph is a Tony Award-nominated actress, Dreamgirls, Independent Spirit Award winner, To Sleep with Anger, an honored HIV/AIDS activist. Ralph's award-winning body of work in film includes Distinguished Gentleman with Eddie Murphy, The Mighty Quinn with Denzel Washington, Sister Act 2 with Whoopi Goldberg. Television includes Moesha, Designing Women, and ER. And on the Broadway stage includes originating and creating the role of Dina Jones on Broadway in Dreamgirls. A passionate AIDS activist, Sheryl Lee Ralph is founding director of the Divinely Inspired Victoriously Aware, also known as the DIVA Foundation. The DIVA Foundation, founded in 1990, is a 501c3 nonprofit organization created as a living memorial to the many friends she had lost to HIV and AIDS as an original cast member of Broadway's Dreamgirls, and because of her concern for the threat of HIV and AIDS posed to women and children. In her work of driving infectious viruses away, the foundation focuses on HIV and AIDS awareness, testing, erasing stigma, lowering of the HIV infection rate, especially as it pertains to women, girls, and young people, and the development of new and effective programs to combat the disease using the arts. The foundation disseminates information and provides advocacy and mobilization from a uniquely and unapologetically artistic, feminine point of view. Sheryl Lee Ralph was awarded the first Red Ribbon Award at the UN for her unique use of the arts in HIV/AIDS activism. Rich in creativity and spirit, Sheryl Lee Ralph designed a successful line of socially conscious red ribbon t-shirts which offer responsible messages in style and in beauty. She has received doctorates in humane letters from Tulane College and Houston University in recognition of her AIDS activism. Ms. Ralph is the producer and creator of the critically acclaimed Divas Simply Singing, the longest consecutive running musical HIV/AIDS benefit in the country, celebrating 21 years of artistic activism, AIDS activism, in Los Angeles. And you can also visit www.thedivafoundation.org for more information. She is added to the critically acclaimed one-woman show, Sometimes I Cry, written and directed and performed by Ralph herself, with the lives, loves, and losses of women infected and affected by HIV and AIDS. To her list of outstanding credits, performed around the world, Sometimes I Cry touches the heart, leaving audiences deeply moved and encouraged to know their HIV statuses. A popular commentator on HLN Showbiz Tonight, Sheryl Lee Ralph completed Christmas in Compton with Omar Gooding, Eric Roberts, and Keith David. That's also been Sheryl Lee Ralph's book, Redefining Diva, which was, I'm coming close to the end, I'm almost there. I gotta read this though, this is good. This is juicy stuff. Which also includes her book, Redefining Diva, which was published by Simon & Schuster, spring of 2012, an honorary member of Delta Sigma Theta Sorority Incorporated. She holds the distinction of being the first and youngest female to graduate from Rutgers College at the age of 19. She also completed a series known as One Mississippi. Ladies and gentlemen, please join me in welcoming to the stage Ms. Sheryl Lee Ralph.
but I sing no victim song. I am a woman, I am an artist, and I know where my voice belongs. I am an endangered species, but I sing no victim song. I am a woman, I am an artist, and I know where my voice belongs. I know where my voice belongs. And today, I know for the most part, I'm talking to the choir. So choir, you've heard some lyrics, statistics today, which I hope we all now know we must learn to sing a new song. We have some very difficult work to do. And I'm going to take you back to the beginning. 35 years ago, which will be very difficult since I'm only 36 myself. What's so funny? December 20th, 1981, I made my Broadway debut in what has become the iconic musical of the 80s, Because I Say So, Dreamgirls. Dreamgirls was the best and worst of all times for me. The best, of course, was being the belle of the ball on Broadway. Anybody who was anybody came to see us on Broadway, including that man right there from Grady. They were all there night after night, and we created something called SRO, Standing Room Only. And for the price of $15, you could stand in the back of the theater to watch the Dreams do their thing. Oh, it was amazing. And I met everybody from Michael Jackson to Whitney Houston. She was only 19. Who else? Diane von Furstenberg. Let me see who else. Name somebody. That's right, I met them all. And in the midst of those good times came the worst. And that was when my friends just started dropping dead. They just started dropping dead of a mysterious disease. See, they got sick and they died. They got sick and they died. Some of them developed those strange purple marks on their bodies, and they died under stigma and shame and silence because nobody wanted to talk about that gay disease. And it was an ugly time because good people, kind people, people of all religions, faiths, and beliefs found it easy to cast judgment on people, saying that's what they get. That's what they deserve. God will take care of them. And what did the real good people do? What did the saints do? They remained quiet. And the silence was deadly. And America just couldn't wait to show gay people just how much they hated them. They would chase them down in the street and beat them with bats. You all remember gay bashing? That was real in America, and good people did that. Good American people. And guess what? It was okay. Because what did the good people do? They remained silent. Because that's what those gay people deserved. And let's not talk about when black folks started coinciding with the deaths. Remember, we were having our own problem with crack. Y'all remember crack houses? You remember the way people found it easy to make fun of crackheads? You know, how people thought it was okay to act like this was no real epidemic. After all, it was just young black folks. And what did good people do? They remained quiet. So 35 years later, what are we doing? The same old thing, because we're quiet. I dare say a lot of folks don't really care about those gay, black, young men. Did you just connect all those dots I laid out for you? So let me say it again. 35 years ago, America didn't care about gay people. Folks found it easy to drop their sick children off on church stair steps like bags of used clothing at a rummage sale. They found it easy to turn their backs on their children, on their father, on their uncle, on their friends, like, oh, it ain't happening to me. Oh, that's not in my family. Oh, no, we don't have any of those people. Stigma, shame, silence. And they died a horrible death. And you would go to the hospital to look for your friends, but you see, there was no hospital bed for them. No, you would find them on a gurney, pushed out in a hallway, dying for help. But there was no help for gay men. 35 years later, you heard him tell you, we've got a new epidemic. Gay, bisexual, young, black men. And you know you hate them. You know you don't like them. You know their lives don't matter. You know they come through the door sick, indigent, vulnerable, you know what you already think about them. Because if you thought something different, something would be going on different, but it's not. You don't have to clap for me, because you don't have to clap for the truth. You don't have to clap, because it's hard for you to hear. It's hard for you to react. It's hard for you to care. It's hard for you to organize. It's hard for you to strategize. It's hard for you to help. It's hard for you, and you ain't sick. I always have to apologize to audiences and remind them, you invited me. So I don't know where we go from here. I don't know who are the people that value life, period. I don't know who are the people who stand up and say, do unto others as you would have them do unto you. I don't know who are the people that say, I just love you, because I don't know who those people are. Because I am confused. 35 years later, I never thought that I would see a time when someone would sit and tell me this is now a young person's disease. I hope we don't let ourselves become like continents, countries like South Africa, where the disease is systemic. That means it's just part of who the people are. And that can happen. But it doesn't have to happen if we care enough. And talking about care, health care is very, very important. Why? Because prevention is better than cure. Why? You just heard it. By the time people present at the emergency room, it's an advanced state of disease, and it is very expensive. It's $1,000 just to walk through the emergency door. $1,000. Wouldn't it be nice if we cared enough about human beings to make sure that we keep them healthy? Because sick people are very expensive. Don't add ignorance to it. Don't add ignorance to it. But then again, guess what? We don't care enough to keep people healthy. We don't care enough to educate people. I said it. She said it. That white lady right there said it. What's your name? Christine. Dr. Christine. Said, when the numbers are low for children and they get to the 3rd grade, she was nice. She said they are 3 times more likely to drop out? Well, guess what? They are 50 times more likely to go where? Prison. Prison. And when we don't educate them, guess what? They hit your children on the street and keep driving. They break into your cars for your phone charger, costing you quite a few $100s for your $5 phone charger. You know I'm telling you the truth, because y'all live in Atlanta. Imagine if we cared enough to keep people healthy. Imagine if we cared enough to educate people. Imagine if we cared enough about ourselves. Because like an old drag queen once said, if you can't love yourself, how in the hell you gonna love anybody else? You don't have to clap for that truth, because this is hard for you. You want to know why it's hard for you? Because you know better. And your mother and your grandmother told you, when you know better, you do better. So if you think I'm raising the bar high for you, I'm not raising it high enough for you. Because I'm asking you to do something great. I'm asking you to care. I'm asking you to do more. And I'm begging you to do better. 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 Those are my friends right there on that quilt. I lost them early, and they were not included in the quilt because of stigma, shame, and silence. And when I found out that that quilt was over 50 miles long and half a mile was dedicated to people of color, I said, we got to get some money. We got to do something to include people so that we can raise their names up, so that people can know they were good people, they were kind people, they were loving people, they were children of God. Don't act like this didn't happen. Don't act like this isn't really happening. Don't act like it doesn't matter. Because there are only 2 kinds of people that this happens to: living human beings. Got to be alive. You got to be human. Although I have heard that there is an HIV for cats. Isn't that right? Thank you. Y'all think I'm making jokes. Tell him, Mr. Grady man. There is a feline HIV, right? Thank you. I know what I'm talking about. I don't just look like this. Yesterday, we added the name of my friend and my neighbor. Her name was Sheryl Anderson, and I'm very happy that her parents are here today, and they put a stitch in her quilt, Mr. and Mrs. Anderson. And on Friday, I lost my friend Noma, who died of AIDS in South Africa. Noma was an incredible warrior who introduced me some 10 years ago to the fact that grandmothers, or as she would say, grandmothers, were losing their lives for caring for their grandchildren. By the simple act of loving, they too were becoming infected and losing their lives, caring for the children who had no parents, who had gone on before their parents. So today, you think nobody's dying? Trust me, they are really dying. And if we don't want to see a repeat of 35 years ago, we've got real work to do. My name is Sheryl, and I love you just the way you are, which is perfect, but I'm asking you for better. Thank you.
Can we give Ms. Ralph another round of applause? Thank you for an inspiring message, for an impactful call to action.